Make sure to read the medication guide and instructions for use provided by your pharmacist before starting to use Humira, CF, Psor-Uv-Adol Hs Injector Kit. If you have any questions, ask your doctor or pharmacist. If you are using this medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional and the product package. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. If you are removing this medication from the refrigerator, leave it at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication any other way, such as by heating in the microwave or placing in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed. Inject this medication under the skin on the thigh or abdomen as directed by your doctor, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule/higher dose at the start of your treatment. Carefully follow your doctor's directions for using this medication. Make sure to learn how to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. Tell your doctor if your condition lasts or gets worse. If you experience redness, itching, pain, or swelling at the injection site, make sure to inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the risks. Many people using this medication do not experience serious side effects. Be sure to tell your doctor right away if you notice signs of infection, such as a persistent sore throat, cough, fever, or trouble breathing. You should also report any serious side effects, including heart-related symptoms, changes in mental/mood, unusual bleeding, or vision changes. In rare cases, this medication may cause serious liver disease, so your doctor may order blood tests and monitor you for symptoms. Seek medical help immediately if you experience symptoms of liver damage, such as nausea, loss of appetite, or yellowing of the skin or eyes. It's important to know that a serious allergic reaction to this drug is rare, but if you notice any symptoms such as a rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you experience any serious side effects, such as seizures or chest pain, seek medical help immediately. It's important to talk to your doctor or pharmacist before using adalimumab if you have any allergies or medical conditions, especially if you have had recent infections, blood or bone marrow problems, seizures, certain brain or nerve disorders, cancer, heart disease, or lupus. Adalimumab can make you more likely to get infections or may make current infections worse, so it's important to stay away from anyone who has an infection that may easily spread. You should also talk to your doctor if you have been exposed to an infection. Before getting any immunizations or vaccinations, make sure to let your healthcare professional know that you are using adalimumab. It's also important to avoid contact with people who have recently received live vaccines. To lower your chance of getting cut, bruised, or injured, be cautious with sharp objects like razors and nail cutters, and avoid activities such as contact sports. Before having surgery, make sure to tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be at greater risk for infections and cancer while using this drug, and during pregnancy, this medication should only be used when clearly needed. It also passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware that Humira, CF, Psor-Uv-Adol Hs Injector Kit may interact with other medications, which could affect how they work or increase the risk of serious side effects. This is not a complete list of all possible drug interactions, so it's crucial to keep a record of all the products you use, including prescription/non-prescription drugs and herbal products, and to discuss this with your doctor and pharmacist. It's essential to not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Humira, cf. Psor-Uv-Adol Hs Injector Kit include other TNF blockers, such as etanercept, infliximab, and other drugs that weaken the immune system, such as abatacept, anakinra. Be sure to discuss any potential interactions with your healthcare provider. If someone has taken too much of the medication and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share this medication with others. While using this medication, it's essential to undergo lab and/or medical tests, such as complete blood count and liver function tests. Make sure to keep all your medical and lab appointments and consult your doctor for more details on these tests. If you forget to take a dose, it's important to talk to your doctor or pharmacist to figure out when to take the next dose. Never take 2 doses at once to make up for a missed one. It's important to store Humira, cf. Psor-Uv-Adol Hs Injector Kit in the refrigerator, making sure not to freeze it. Some brands may be stored at room temperature, so check with your pharmacist or read the product package for instructions. Once stored at room temperature, do not put it back in the refrigerator. Keep the medication in the original container to protect it from light and discard any unused portion. Be sure to keep all medications away from children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.